remove a nasogastric tube, first I go into the patient's room. I introduce myself as a student nurse. I verify the patient's identity, explain to the patient what we're doing, that we're removing the tube. And I'm going to do my hand hygiene, or actually I'm going to provide privacy first, because if it's a curtain, those are gross, so I need to do hand hygiene after that. Then I'll do my hand hygiene. I will go ahead and ask the patient to sit up. I'm going to put a towel on his chest, her chest. Because when this tube comes up, some contents are probably going to come up with it. So I'm going to make sure that I have a trash bag ready for when that tube comes out. We need to put it in a trash bag. It's going to be gross and leaking everywhere. So put the towel on the chest and glove up. If there's any section attached to the tube, I'd remove it or detach the tube from the section, unpin it from his gown, and I'm going to take this tape off of his nose. So I'd remove the tape. I don't have to remove it off the tube. That's not going to mess with his skin. So anyway, so the tube is in. And then what I could do, and it's optional, is to pump 50 mLs of of air into the tube to clear it out before I pull it out. So what I'm going to do is tell the patient to take a deep breath, and that just kind of closes off the glottis to help prevent aspiration as I pull the tube out. So I'm going to tell him to take a deep breath and hold it, and then I'm going to kink the tube with actually should be on the other side. I'm going to kink the tube with this hand, and then I'm just going to pull it out with one smooth, not too fast, not too slow motion. Okay, and then when I pull it out, the reason I have this towel here is so I can kind of set it on here and then put it in a trash bag. Okay, and then I'm going to fold this up, put it right there with the bag. Ask the patient if he's comfortable, if there's anything I can do to help with his comfort, like mouth care, and some of them might want a Kleenex to blow their nose because the secretions build up in there while they have the tube in. Then I'm going to dispose of everything, not untouch my uniform with them. I'm going to dispose of all of this in the proper bins, like this goes in the dirty laundry basket, and then wherever they tell us to throw this away, whether it's in a trash or a special receptacle. And then after that, I'll remove my gloves. Oops, I just broke that one. Throw them away. I would do hand hygiene just because I'm going to touch that computer and I don't want any transferring, but I would do hand hygiene, and then I would document, then I would do hand hygiene again. That's what I would do.